Hi everyone, my name is Laura Schofel. I am a bachelor's prepared registered nurse, and I'm going to talk about the theory of self-care of chronic illness. And this is for Nurse 6030 Advanced Theory in Nursing for Harding University's Family Nurse Practitioner. So, what is the theory, or what is the self-care theory? Well, it's been studied since the 70s, but we're just going to focus on a few studies today. So the main one that we'll focus on was done by Regal. The last name is Regal. So initially, when this theory was first developed, it was evolved from clinical practice in patients with heart failure. So during the clinical experiences, they saw challenges that patients had in caring for themselves, and this formed a theoretical base for the theory. So to start, self-care is considered essential in the management of chronic illness. It's defined as a process of maintaining health through promoting practices and managing illness. And so self-care is performed in healthy patients and in sick patients. It's not just critically or chronically ill patients. Self-care is performed in healthy patients as well. It's not black or white. It doesn't look the same for each patient. With chronic illness, though, patients are sick long term, and so they must learn how to provide much of their own care through the duration of their disease process. So when providers interact with patients, the goal is to form kind of a partnership that will inspire and motivate them to perform their self-care so that they can incorporate these tasks into their lifestyle. So if healthcare providers can understand the process that the patients use in performing their self-care, then they can use that information to kind of identify where a patient struggle and help them come up with a plan for their care. So this study by Regal was strongly influenced by Orum's work on the self-care deficit theory of nursing. But the three main concepts in this study were self-care maintenance, self-care monitoring, and self-care management. So self-care maintenance is behaviors used by the patient with a chronic illness to maintain physical and emotional stability. So for example, be related to their lifestyle, like preparing healthy food, smoking cessation, or taking meds regularly as prescribed. Adherence is really important in self-care maintenance, and it's vital for the nurse practitioner to work with the patient to adopt as many of these positive behaviors as the patient will tolerate. And it's important to emphasize the ones with the best evidence to support them. So obviously, if a patient has asthma, then you're gonna want to prescribe a bronchodilator for them, and the patient will hopefully adhere to that. But if you prescribe something like jump up and down and spin around in circles 3 times, they might look at you kind of funny, like, where's the evidence to support that this is going to help my asthma? Give me something with evidence. So next is self-care monitoring. And that's the process of observing oneself for changes in signs and symptoms. So for example, monitoring weight regularly. You might go to the dentist to monitor how your success in avoiding cavities. In a chronic illness, monitoring that has a system and its routine typically produces the best outcomes because these patients are doing this day to day and need to get into a routine like checking blood sugar in a diabetic, daily weights um, in the morning in patients with heart failure. And the overall goal is just to be able to acknowledge that a change has occurred so that they can intervene early. With self-care management is how do they respond to the signs and symptoms when they occur. So understanding that a change has occurred and deciding what's the best course of action. So for example, shortness of breath in an asthmatic patient would require the use of a bronchodilator. Shortness of breath in a heart failure patient may require an extra diuretic. Patients must also know when to contact their healthcare provider for guidance in the next step. And then the final piece includes evaluating the effect of the intervention to determine if that intervention should be used the next time. So all these concepts are related to each other. So types of self-care is shown on this slide. There's several different types. Self-care may be sufficient or insufficient, purposeful or unintentional, reasoned and reflective, or automatic and unobservant. Patients with little knowledge or poor understanding of their care will perform little self-care of any quality, like in the bottom left. And then there's the patients who will provide great care, but they don't reflect or observe their outcomes, like the top left. So like, for example, patients that take their blood sugar, but they don't know why, or they're taking their meds, but they don't know what they're for. And then there's patients who do a great job monitoring themselves, but they don't know what to do with the information. And then the bottom right shows patients who are reflective, but they refuse not to engage in self-care. That may have to do with cost benefit or quality of life. And then the ideal combination is the top right. Purposeful, reflective, and sufficient self-care. They're knowledgeable about their disease process and how to gather data and how to intervene when necessary. These patients are typically either very self-motivated or have received some really good education from their healthcare provider or a combination of both. So a few findings from the study. There are similarities in self-care across many chronic illnesses. For example, self-care monitoring is needed in patients with heart failure, diabetes, and cancer. Those who have experienced providing care for another are typically better at self-care, which shows that the process can be learned. Misunderstandings and misconceptions and lack of knowledge play a big role in insufficient self-care. Monitoring for changes in signs and symptoms is necessary because in order to make a decision about the care and what to do with that information, you have to first notice the change. All right, and then according to Chin and Kramer, how clear is the theory? Is it understandable? Yes, it clearly lays out different types of patients and how they might handle their self-care in a chronic illness. Chin and Kramer state that when the definitions reflect general and specific traits, clarity is enhanced. How simple is the theory? It's very basic in its overall theory. It's easily understood. It provides relatively simple and broad theory to help guide practice. How general is it? It's a specific theory pertaining to patients with only chronic illnesses. However, the theory includes many different types of chronic illnesses because care needs are often similar. It's accessible. Accessibility includes how attainable the projected outcomes of the theory are. So in this case, the projected outcomes are challenging because a chronic illness can be really long-term and hard to manage, especially since each patient is so different. It also is hard to measure success and failures in the theory. How important is the theory? Importance is tied to the theory's clinical significance or its practical value. Does it create a reality that's important to nursing? And yes, absolutely. Chronic illness is so common in our healthcare today, having a game plan on how to tailor patients or plans to each patient, provide encouragement, prayer, counseling through the span of their illness. It's hugely important for our in our roles as nurse practitioners. All right, so one supporting article, they interviewed 26 adults with a variety of chronic illnesses, and their main focus was to understand the main concern of self-management in people with chronic illnesses. They found individuals have their own beliefs about the illness and its severity, and they also have the capacity to make their own decisions. They found inner conflict called the multiple self problem, and that is the main concern of understanding the self-management process was that conflicts arose within the patient. So there was conflict between their medical and social needs. There's tension between what the patient wants to do and what experiences tell them that they should do. So it's important to figure out what their goals were, medical, moral, social, personal, and once they figured those out, it helped hone in on their care. Findings in this study show that the process of negotiating self-management starts with the individual figuring out their personal beliefs about health and illness. One finding that was consistent with Riegel's theory is having support and external resources was commonly given as a reason for success or failure in self-management. So if a patient felt that they had a support network, they were more likely to provide better self-care. Another key finding was the importance for health professionals to understand the power of the stigma involved with chronic illnesses and to help people reduce those feelings. The stigma of chronic illness does occur, and it leads to social rejection in some cases, and so that can either be impeding or motivating to a patient, kind of depending on the patient. They may shut down and not want to provide self-care, or that could actually motivate them further. Another study was a literature review regarding self-care of chronic illness, and it stated that there's a challenge regarding the agreement of definitions of the terms self-care, self-management, self-help, so it makes it challenging to study. They have developed several self-care assessment tools that have helped. Developing a general non-disease specific assessment tool could help evaluate complex patients, and having a systematic evaluation of self-care in clinical practice would help identify behaviors, but more studies need to be done. And finally, the importance for nurse practitioners. So not everyone is capable of performing self-care, maybe due to limited memory, psych issues, sleep deprivation. So in practice, the nurse practitioner must assess the needs of the patient. Those who are struggling to recognize their symptoms would need different interventions than someone who is poor in self-care maintenance. If the nurse practitioner can assess where in the process the patient is struggling, then they can tailor their interventions better. The idea that different cultures view self-care differently and have different areas of focus is important for the nurse practitioner to understand. What the practitioner thinks is most important may not be what another culture thinks is most important. We must be able to assess whether a patient understands the signs and symptoms and changes in their illness, and then what to do with that information once they recognize it. So it's important for us to educate the patient and then have them repeat back to us their understanding to verify that they understood what we told them. So just as the theory states that our patients need to be able to assess their condition and know when to make changes based on their assessment findings, we as a nurse practitioner also need to be able to assess our patients' knowledge, their learning style, motivation, etc. And if we don't assess that there is a problem with our patients or their ability to care for themselves, then we won't know when and how to intervene and how to best help them. Thank you all for joining me. I hope you learned a little something about the theory of self-care in chronic illness.